Thank you, everyone, for joining the first ever Men's Summit. Our session this afternoon is titled "Too Often Ignored: Health Disparities Among Men of Color and the Impact on Their Family." I'll be your moderator today, and after introductions, we will. Introductions, we'll get right at it. So. Let me just give you an overview real quick of our speakers. We have Mr. David Crowley, who will definitely speak more, Mr. County Executive of Milwaukee, Mr. David Crowley. We also have Dr. Ashok Rai. He will be, he's on a little vacation, but he's smiling and he's with us, so we appreciate it. And then we also have Isaiah Funmaker, so really pleased to have these gentlemen with us. I'll begin with introductions. My name is Aaron Perry. I'm the president and CEO of Rebalance Life Wellness Association. We are a nonprofit organization focused on improving the health of Black men in southeastern Wisconsin. I'm hearing a little bit of echo. Hopefully we can correct that. But we are a nonprofit organization really focused on improving the health of Black men and boys in southeastern Wisconsin. So with that said, I am an fellow with the Health Evolution Forum. I am also the world's first African-American diabetic to complete an Ironman. So when I talk about health, I walk the walk and I talk that talk too. But what I can tell you is this is a very important discussion that we are going to have today. And let's go ahead and start with Mr. Crowley. If you can introduce yourself, and then we'll follow that up with Dr. Rai.
Absolutely. So thank you so much, Dr. Perry. My name is David Crowley, County Executive of Milwaukee. I've been elected since May 4th, so I have not even had a full year under my belt, but excited to be leading Milwaukee County. And our mission right here is to become the healthiest county in the state of Wisconsin by achieving racial equity. And so I'm really excited to be where we are today and really excited to be a part of this conversation with these gentlemen.
All right. Dr. Ashok Rai.
Hi, everyone. My name is Ashok Rai. I'm the president and CEO of Purveya Health, headquartered in Green Bay, but kind of spread all around the state these days. Also a practicing physician, trained in both internal medicine and pediatrics, but most of my practice has been on the adult side in internal medicine, originally from the Detroit area, but replanted into Green Bay. So I've been here in Wisconsin, in Green Bay for almost 20 years now.
Oh, all right. Mr. Isaiah Funmaker.
Hi, how's it going? Isaiah Funmaker, Ho Chunk Nation, Department of Health. Been here for just under a year. I got temporary reassigned for the COVID response, ICS. I'm an incident commander. I go out west, I go fight fires. So I got, that background. And yeah, just part of the team. Heard some really good things from the goings on from today and yesterday, doing vaccination pods. So I was really wish I could have made it, but yeah, glad to be a part of this conversation. Thank you, guys.
Yeah, excellent. And if I can get off the subject real quick, have everybody been vaccinated yet?
I got my first shot.
Oh, excellent. Yeah. So we did so I opened the nation's first men's health clinic in a barbershop back in 2016. And one of the things, we were doing a lot of surveys and really just trying to get at how do men feel about the vaccine. And so we did a bunch of surveys and it found out that there was not this high level of mistrust. It's just that guys are just paranoid about the process. And so we started providing a lot of information, very clear, strong, aggressive information campaign. And all of a sudden we did this vaccine clinic and we had over 100 guys show up to get vaccinated. So that was a win. But let's get to these questions today, because one of the areas that we're focused on when we talk about, too often ignored, this is an area that we've been having this discussion for some time. What I can tell you, based on the work that I've been doing, the state and nationwide, they have listened to the voices of Black men but they have completely ignored our pain. And if we intend to really make progress, we have to be better at not just listening to someone's voice, but understanding their pain as well. So I want to get to these first questions. Let's start with, how do the disparities that we see in COVID-19 reflect the already existing social and health inequalities for our Black and Brown men in our communities? Who wants to take that first?
I'll take a shot at that one.
Excellent.
In a little of my experience, you look at the virus itself and how it infects and how it kills, and then you layer that upon the Black and Brown community specifically, and it's kind of almost like a multiple strike situation. So you look about how the virus spreads. It spreads from person to person very quickly, and the only way that we could mitigate that was to stop being around people, right? So, but if you looked at the Black and Brown communities, that's not as easy that's a lot easier to say than it is to do, especially from a socioeconomic standpoint. Living in Green Bay, Northeast Wisconsin had some of the largest outbreaks in the world on a per capita basis. Why? Because of the industry within our area, especially meatpacking plants. Now, if you've ever gone to a meatpacking plant, there is no physical distancing possible in that situation. But then if you look at the employees that depend on those paychecks, that's not a job you can do by Zoom. And so you're in this situation where you are not given the right equipment or the right structure to protect yourself, and you're going to be exposed to this virus. So it's almost like it's impossible not to get infected and still try to feed your families. Actually feed the country. As I was told one day, I'm like, just shut the dang plant down. And I'm like, no, that would affect the entire food supply for the country. Then my vegetarian wife speaks up, and then we have this nice argument there. And then, so you take that's one big strike, right? So you can't avoid it. And then you talk about how the virus kills. It definitely affects people with underlying health conditions more than it would, say, a healthy person. So somebody with hypertension, obesity, heart disease, diabetes, that's who dies. And if you look at kind of disproportionately, Black and Brown communities carry more chronic disease than, say, a white person does. Some of that is a genetic issue. A lot of that is what we'll get into today: lack of access to care, lack of knowledge about care. So you've got a disease that you can't avoid. And when you get it, it's going to disproportionately kill you because of your underlying, what's there in society. So COVID was like a massive magnifying glass on, the systemic racism within healthcare. It's never been shown more acutely when you look at the Black and Brown communities' infection rates, its death rates, and there's no way to ignore that it's not just the virus. It's decades, hundreds of years of issues that all of a sudden kind of came to pop. So that's really what COVID has done, and why it affected those communities, our communities, more than it did others.
Just to piggyback off that, first and foremost, thank you for that, Doc, because I think many of us knew about many of the healthcare issues in the African-American community, but particularly also with men. When we talk about a few that the Doc mentioned, hypertension, heart disease, diabetes, we knew that these things were issues in the Black community. But when COVID came, it literally put a magnifying glass on an issue and exacerbated all the things that we have seen. Because particularly right here in Wisconsin, when we seen COVID ravage through the communities, how it affected Black and Brown communities first. And when you think about, those underlying health conditions, which we're going to talk about a little later, is that, you have so many people who are in underrepresented communities, who live in marginalized communities that have been historically ignored, to the point to where we had to figure out ways to really deploy vaccines and testing in these communities because of many barriers that they've had in actually getting access to care. So many people in communities of color may not know they have a chronic illness because they have not had that ability to establish care with a healthcare provider. And so I would say that what COVID has really taught us that is that we have to focus on these health outcomes. It's one of the things that we're really focused on here in Milwaukee County, and really those 5 social determinants of health. When you think about, access to healthcare, education, your environment, all these other things, all these other factors that play a role in all of our health outcomes. So we have to use this as a moment and turn it into a movement and really tackling the issues that we're seeing related to healthcare, but making sure that we can have these conversations on a community level as well as on a clinician level, because we have to make sure that people understand that there is some historical trauma when we think about healthcare, particularly in the Black community.
Yeah, we're at an interesting tipping point with COVID, and as far as the health of our Black and brown communities, because right now COVID is a global disease, right? It affects white people, it affects Black people, it affects brown people. And the only way for us to get past it is really through vaccination. I think we've all talked about that, and we can talk a little bit more about that. But suddenly you have this situation evolving very fast right now, especially in Wisconsin, where our vaccination rates amongst our Black and brown communities are nowhere near where they need to be versus our white community. So what is a disease now that globally affects everybody and gets a lot of attention and a lot of funding is quickly going to become, if we don't change our language, if we don't change the current paradigm, it's quickly going to become a Black and brown disease. And all of a sudden, you're going to see a shift in the attention, the safety, the funding around it. Just that's unfortunately how our society has been built. So if we don't do a better job on the vaccination side and the education side, this quickly will then become another disease that particularly affects our Black and brown communities, and it will not get the level of attention that it's gotten to this point, because it won't be an everybody disease anymore.
Mr. Funmaker, you want to take a shot at that? Are you good?
Yeah, what I have over here, what we got is, a lot of the, of course, right off the bat, there's no trust. And how do we go ahead, as far as like being a leader in the community, going out there and, putting out my story, my share, and, just hoping for the best, but just really hoping to get some, traction and keep going forward. So, yeah.
Yeah, thank you. Thank you for that. One of the areas that I tend to, as I hear us talking about COVID, my colleague, Dr. Alvin Thomas, he's with the UW School of Ecology, and he does a lot of research following these major storms and these cataclysmic events. But one of the areas that we have been able to show is that after these major events, and there was an article that actually ran in the Milwaukee Sentinel, well, it talks about the life expectancy already declining. I believe it's for the general 1 year, but they did specifically say for communities of color and especially Black people, we're talking about life expectancy, a 3-year loss of life expectancy. And that's pretty significant. But it's consistent with this research that Dr. Thomas does or focus on. And that they're, again, focus on these cataclysmic events. What is life after these big events? People are uprooted from their homes. People are, particularly when we talk about this, just focusing on diet, for instance. We see this significant increase in body mass index, and then all the poor health problems kind of gradually flow from there. And so that's a discussion that I hope that at some point we can all regroup and get back together, because as I look at the panel, it is our communities that's going to be impacted the most by that. So let's go to the next question. How do we get men of color to take the first step and make that first appointment? How do we get them to make the follow-up? And what does that teach their household about making those first steps?
I'll go ahead and try to tackle this one first. We have to start having these conversations. I grew up, 2 brothers, my dad and my mom. My mother was the only one in the household that was a woman. And we seen her go to the doctor all the time, but we never established that consistency as men. And now being a father myself, where the role is reversed, I'm the only male in the house and I have 3 young girls. They are establishing that consistency of going to the doctor. And so when you think about it, we as men have to have some really tough conversations with one another to talk about health. And many of us may not be comfortable having those difficult conversations, but it is conversations that we have to have because we have to establish a normalcy within our culture, Black community, or our culture as men, in going to the doctor consistently, doing your yearly checkup, seeing what's wrong, because it's better to know than not to know at all whether you had a chronic illness or not. But I would say that, here at Milwaukee County, we've partnered up with nonprofit organizations, the City of Milwaukee, the Fatherhood Initiative, to actually have summits. And I would say, right now, this is an opportunity for us to break down those barriers. And I want to say thank you to Madison 365 for creating this platform for men to be able to talk about, what it means to be healthy and what does it mean to teach our children about health and going to the doctor. But we also need to make sure that we're, again, tackling the historical notions between our community as well as the healthcare industry, and really breaking down the barriers, the myths, and really putting the facts out on the table. I mean, I think that also with the fact that living in the social media world where you have everything literally at the palm of your hands, you have to be able to decipher what's real and what's not. And sometimes that can be difficult. And so it's important that as men, we start to band together, talk to our friends, talk to our neighbors, talk to our family members about the importance of health, because the consistency needs to be there. We have to establish this care on an ongoing basis, because it's going to be difficult. I would say it is like ice skating uphill when you think about trying to get, my brothers or some of my uncles to go to the doctor. But when you talk about the love and the impact that they have on you, they understand that this is just not about, them being able to wake up the next morning for themselves, but how it affects their whole family as a whole.
Mm-hmm. Yeah.
There's just so many norms that have been embedded into what a man thinks about healthcare that we just need to get past. There's just so many things that this is not just brown men, this is white men, this is just men. And if you think about healthcare across the continuum, women usually start getting really good about healthcare with one event that happens, pregnancy. So they establish care and then they establish a routine. And young women have a tendency to establish a provider for the entire household. You wouldn't believe how many men I know, as I've seen, when they list a primary care provider, that lists their wife's OB because it's the only doctor's name they know. It happens a lot. Or I've got a 50-year-old guy who still lists his pediatrician. I mean, we've seen it over and over and over again. Men are just really not good about this. There is a cultural machoism that comes in with it, that, nothing can hurt me. There's just so many barriers. And then you start to narrow it down to the Black and brown communities. We start bringing in other barriers, such as the financing of healthcare has been kind of a national disaster for a long time. And so everybody thinks it's going to bankrupt my family if they find something wrong with me. I can't afford X, Y, or Z. The knowledge base about how to pay for it all is just not there. So, and I'll say this honestly, because we're a bunch of friends here. We don't have doctors that look like the patients we're trying to address right now. I was the second brown person employed by Prevea. When I came up for my interview, the CEO at the time was out of town. They specifically created it that way because he didn't like hiring people if he couldn't pronounce their name. And, now that I am CEO, we have a significant amount of African-American colleagues and partners that I have as physicians and friends. But if you go to med schools, if our county executive went, down to MCW and looked at its current class, it's still not going to look as diverse as it needs to. And so we don't really, this is going to be a problem that's not going to get fixed overnight, but we don't have, and I think Isaiah he used the word that's going to come up a lot today. We have not earned the trust of the Black man in the exam room. We just haven't done it. We've done everything possible to lose that trust. We've bankrupted families. We haven't involved Black men effectively in research. When it comes to enrolling trials, we assume that the drugs we have are going to work just fine on them when they don't. And we find that out and then have to repivot. There's just a lot of failure systemically in healthcare that we've kind of failed that patient. So we've not earned that trust.
Yeah, excellent point. We have, we do a lot of surveys in our men's health center in the barbershop, and we're very blessed to be able to have that space. And Madison's largest Black barbershop, we also just opened a second site at another barbershop, Be Right Barbershop in Sun Prairie. But we're starting to have those real deep discussions. And one of the surveys that I remember seeing, we just started having a little fun with that because it was real, it was raw. But what basically came out of it, the guy took time and just wrote out this real beautiful narrative. But in essence, he stated that men will go out, they will get their education, they will work hard to get that nice job, they will climb the corporate ladder, they will build that beautiful house, have that lovely family, that lovely wife. But the one thing they don't do is take care of themselves. And unfortunately, they die early. And then some other suckers lying their head on their pillow. And, the guys all laugh about that. But if you really think about it, when I start sharing that story with guys in the barbershop, they're like, oh, shoot, that got my attention. So now we have guys that are coming in and, getting their blood pressure checked and on a consistent basis. But the really neat thing about it is guys are having fun with it, but they're also hearing that message. That resonated with them. We had one guy that said, I know if something happens to me, I'm going to come back and sit on the edge of the bed, and we can have those funny conversations. But at the end of the day, ultimately, what we achieved is it got their attention, and they're now getting that haircut, getting up out of that barber's chair, coming in and getting that blood pressure check. And they're talking about sleep studies. And so we hit a home run with that. It was accidental, but we hit a home run with that. So let's get to this next question. What conversations do men of color need to have with each other about their health? How do we make space for those conversations? Where should they happen? If I can start with that, you have to go where men are at. I've said this for years now. You have to have those conversations in a place, in a space where men are comfortable, where where we know that they frequent. And oftentimes it keeps coming back to the barbershops. Some of the, fatherhood initiatives program with County Executive Crowley mentioned. So we got to be better at starting to have those conversations and also starting to move some of these, practices, from the hospitals into the community and start having those conversations. When we opened the doors to our men's health clinic, we knew that this would be a transformative care model. And the focus was really on just moving the healthcare upstream, dismantling racism, discrimination, bias. At the same time, we're having these conversations about health. And so, again, I'll read that question again. What conversations do men of color need to have with each other about their health? How do we make space for those conversations? And where should they happen?
I love the barbershop concept. I just got to give you props for that. That's really cool. And I love that because that's, so many times in healthcare and we are probably the most egocentric profession in the world. What we say is right. Don't argue with us. We know what's right. You know what's wrong. And guess what? We're wrong a lot of the time. And I think COVID's kind of shown us that. And so to gain that trust, dragging somebody into an office where I'm dressed up in a tie, in a white coat, in an intimidating environment, and then saying, this is the 8x12 area that I'm going to earn your trust is just not practical, and it's not going to happen. It's going to be, we have to go to the place, like you said, a barbershop. I think one of the biggest things that we've done over the last decade is taking healthcare out of our clinics and into the workspace. So we have clinics in a lot of factories now throughout the state. And that's been a big way to engage men of all color because they're a captive audience, and just popping into the clinic in the factory is just a lot easier. It's a lot less economically damning to that patient as well. Because you think about it, when are we open? We're open from 8 to 5. And we're talking about a population that is very sensitive to keeping a job and to getting a paycheck. So what are they going to use their off time for? Not coming to see us. So we definitely have to rethink, healthcare needs to rethink how people access us and how we do it to build that trust. But we're not going to build it wearing the white coat in our exam room. It's just that's like the worst possible place to gain somebody's trust.
Excellent. And the other part of that is, these costs. We get guys to come in all the time. They talk about the fact that one guy come in, I got sugar last night. He was diagnosed with diabetes, doesn't have health insurance. We talked to him about the importance of knowing what his A1Cs are, staying on top of it, getting his medical team together, maybe with his diabetes educator, nutritionist. But the one thing that's just often thrown back at us is, so you want me to voluntarily go to the hospital, get a $700 bill that I cannot pay? And we hear that often. And so we try to work with our health providers and bring in some of those services to the community, whether it's a barbershop or whether it's a health fair, because that cost is, it's a serious barrier.
And it is a serious barrier, but we have to, again, go out and educate people on the importance of insurance, particularly in communities of color. We know that many folks in communities of color lack insurance, and it may be because of cost. But that's why we have to do things, even like when we talk about Medicaid expansion, so we can get more people to have insurance. But also to touch on, how do we have these conversations and where? We have to, one, identify trusting voices and trusting faces to go in certain communities to have these conversations. I know that I shouldn't be the one going necessarily in central Wisconsin to have certain conversations about health because they may not identify with me. But growing up in the 53206 zip code here in the city of Milwaukee, I'm able to go there and have much different conversations because of my own experience. So we have to be able to identify trusting voices and trusting faces to have many of these conversations. And as we continue to talk about costs, these are the policy discussions that we have been having since, President Obama's first term. And this is something that we're going to continue to have conversations about until we can get, the costs under control as it relates to not just healthcare, but prescription drugs and the list goes on and on. So, really, we have to get involved in the policy making decisions as well to make sure that we make healthcare affordable for everybody. But we also need to make sure that we're building coalitions of different individuals that we can deploy out into the community that can have these uncomfortable conversations and really bring people along as to why their health is not only important to them, but the people that love them as well.
Yes. Yeah. Mr. Funmaker, how do we make time for these conversations or make space for those conversations?
Yeah, I just wanted to say that I always talk about barbershops and I don't have any hair. So I was like, what are we doing, baby? Like, what are we doing for the bald guys? Like, what's going on?
Bald guys go to the barbershop too.
Yeah, right.
I had hair, but I had that Jerry curl and it burned my scalp. So I think my hair don't
soul glow. Very good. All right. Interesting dynamic was that, the country coming underneath adverse times, times of war, so on like that. Kind of seemed like a similar front when it comes to the pandemic. And then, a lot of the warriors go ahead and volunteer. So it's something that, that we bridged that gap before. When it came to wartime is that, we go across seas and, we take care of business. And, it's just like, I guess, getting back into the fight and making sure that, we understand the challenges, of course, with the finances and what have you. But, I just really like to, get out there and create that sort of movement, or put some, behind that.
Right. Excellent point. The next question, gentlemen, is can you talk about what things health systems have ignored and are ignoring with regards to men of color and what the impact is? Can we speak to that a little bit?
I guess running a health system, I can tell you everything we do wrong, and we do a lot wrong. I mean, if you read this week's CDC's report, really on racism as a public health crisis, it really shines a spotlight on everything we do wrong, from how we address the financing, like we've talked a little bit about the cost aspect of it. But we don't generally, when we look at healthcare, we have no focus on fixing it for where we see the disparities. We just keep doing the same old thing. We build hospitals, we build clinics. We don't build them in areas where they're needed. We build them where there's areas that they're not needed, primarily because it's a funding thing. It's money. So that drives a lot of strategic conversations. Race, addressing disparities. It doesn't generally come up on a strategic plan for a health system until I think now, where we are finally getting to that point where, number one, now there's people of color in charge for the first time. For the longest time, if you looked at healthcare, it was a predominantly white run, like most things, but it was predominantly white run. I'm the former board chair of our trade association, the American Medical Group Association. And the cool thing is you go in the boardroom and you get to see the pictures of all the chairs that have ever been, there across the country. Two of us had a tan, let's just put it that way, of all the history of this company. And both happen to be from Wisconsin, so we should be proud of that. Al Kemp, former CEO of Dean Health, and myself. But now you look at guys like Damon Boatwright, taking on a bigger role with Hospital Sisters Health System. You look at Lloyd Dean running one of the largest healthcare systems in the country. You got Black men in charge now. So you're going to see change for the first time. But health systems in general, when they look at what their job is, they have not looked at the healthcare disparities and said, that's my job, until more recent times.
Okay.
No, and I can honestly say a lot of that just recently, Milwaukee was one of the very first jurisdictions in the country to say that racism was a public health crisis. And when we did that, we did see not just the business community, but healthcare partners as well, hop on this mission and making sure that we can break down many of the disparities and the silos, healthcare systems, but all of our different departments and industry operate in. And in reality, we also need to understand what structural racism is when you have policies and inequities, in one system that corresponds with another, that creates that structural racism. And we've seen it play out, particularly with the vaccine distribution, right? When we see, when we say, okay, that group 1A, as far as like emergency response or healthcare professionals, we've seen the disparities out the roof there. And I would say that one thing that I would like to see our healthcare systems do is really how do we start to go into communities of color, work with our young people and start and really start preparing them to actually go into the field of healthcare. I've had conversations with Dr. Tito Izzard here in our own city with Milwaukee Health Services. And I know that he is trying to find ways to bring more people of color into the field. But the thing at the end of the day is that no particular healthcare system can do it on its own. They have to work with one another and correspond and really tackle the systemic racism that we see within the healthcare system and broadly across this country and in this world. But it's going to take us some time. But I will say that I'm glad the conversation is being had now. But it's more about how do we make sure that we continue this momentum into the future and don't let it die out? Because again, everybody's paying attention to COVID. And as the doc said, if this becomes a Black and brown issue alone, we're going to lose a lot of that momentum in actually finding equitable distribution of vaccines and equitable distribution of care in the healthcare system.
Right. Excellent point. Let's continue with the second part of that question. What are men of color ignoring about their own health? And what is the impact not only to themselves, but to their families and communities? I will start with that, and then maybe we can move to Mr. Plummaker. But when one of the things we've clearly seen is that when men of color, especially Black men, when they are healthy, the community is healthier. I mean, you can go and look at the Quad Cities, Davenport, Iowa, some of these other places where when they did an aggressive initiative to improve the health of Black men, you started to see a number of things changing, and that clearly there's a connection there. When Black men, when we're healthier, the community is healthier. But what are men of color ignoring about their own health, and what is the impact not only on themselves but to their families and communities? Mr. Isaiah, you want to take a shot at that?
I'm gonna take a shot at that. Okay. Yeah. I mean, right off the top of the head, just everything that you had said reminds me of, the way that it used to be when we had, before European influence. I technically wasn't there, but we had everything that we needed, right? And we were so connected with everything, and that connection, as far as Native people, has become less and less, and we beginning to start losing our ways and so on like that. And just from our perspective over here, it's just that connection is something sacred to us, and we would like to share that, with our people, our, of course, our Black friends or family and relatives and so on. Just we're all in this fight together. So also Asian and Mexican and so on. But I feel pretty passionately about this. So yeah, I mean, it means a lot, because what is the household with a a leader, a real man, somebody who's out there, as far as like being a protector. They're just going back to nomad type stuff. I mean, but yeah, that's all I got to say. Thank you.
Yeah, thank you. Yeah, one of the areas I can add is in doing those surveys, and so let me back up a little bit. Since we opened the doors to this men's health center in the barbershop, we've served 5,100 Black men, and they can come in and receive this non-invasive preventive health screenings. When I talk about 5,100, there is currently 15,600 Black men in Dane County. We represent 6% of the male population. I throw that number out there because we, in essence, have reached 30% of the Black men in our community. You would think that every health system is running over to us, knocking on the door saying, "What are you guys doing?" But that is not happening. I mean, it is simply not happening. What we have tried to say is that 7:45 to 4:30 time frame that those hospitals and clinics are open, unfortunately, they're based on the surveys. That time frame just does not work for these men. They have a lot on their plate. Keeping the roof over their family's head, obviously working hard. Some of them are working 2 or 3 different jobs. But the other flip side of that is they're also living with 2 and 3 different chronic health conditions. And so we know that this is an area that we have to aggressively get on top of, but more than anything, get the attention of our men. And so, again, the question was, what are men of color ignoring about their own health, and what is the impact on themselves, their families, and communities? So anyone else have?
I would, because I know the doc got a lot, and I know he got a lot more experience than I do. But, one, I would just say that, we're paying attention to all the tangible things, all the immediate threats and all of that, where we're not paying attention to the things that we don't see. We don't necessarily see what is happening within our physical body. And so a lot of the times, when we feel that ache, that pain, a lot of the times men will say, "Oh, well, I'll just deal with it. It's just a little pain. It'll go away tomorrow." And then it starts to get a little chronic. And a lot of the times people wait until the very last minute to actually go get some health care. And so we have to start paying attention to the subtle signs, the subtle differences within our body. But at the end of the day, we have to start thinking as our healthcare as a means to our health and our physical presence on this earth as a way of contributing to everybody on this earth, contributing to our family, contributing to the economy, contributing to fixing all our social issues, because every man out there has something to contribute. Every role may not be for you, but there's a role out there for you to do something that's going to make this world better. And we just have to start paying attention to some of the things that are happening within our bodies so we can make the best decisions for ourselves. But I will also say that, we need to also, check our own biases at times about and not just the healthcare industry, but many of the industries out there as far as how we're going to get treated. And let's just make sure that, I would say we all need to adopt the golden rule when it comes to healthcare, which is we have to get comfortable being uncomfortable. And I will tell you that, yes, it's uncomfortable to hear a doctor giving you a diagnosis of a chronic disease, but it should allow you to have some comfort later on down the line, knowing that you can take steps to save yourselves and become healthier to contribute greater to society.
Excellent.
And I think the gaps are, they're somewhat obvious in a sense of the health screenings need to be there. We need to be, as the kind of executive said, I think we need to be a lot more proactive on the early side. Colon cancer, for example, shouldn't be something a Black man dies of, but we need to get everybody in for a colonoscopy when they turn 50. Not an easy thing to do for anybody who wants to have that done, let alone our rates of cancer screening in African-American, Hispanic communities is significantly lower. Mammography rates for women, prostate screening, there's a lot of things that we can do. But to be honest with you, the biggest area where we fail as men, and especially as men of color, is taking care of our mental health.
Yes.
And it's something nobody wants to talk about, right? And we see a culmination of it over and over and over. You think about the trauma. I was trying to explain this to white friends around, the demonstrations after watching somebody die on TV over and over and over again and watching the same video clip. And I said, all right, understand, since that young Black man, since they're 4 or 5 years old, has had repetitive trauma for their entire life. And then that trauma is triggered when they see somebody that looks like them being killed on TV. And we provide them absolutely no care, no help, no acknowledgement of that 15 to 20 years of trauma. How do you expect people to react? What you're seeing here is a lack of healthcare. In all honesty, what we see here is people are expressing themselves in ways because they're frustrated, they're angry, but they also have not received a level of healthcare around the trauma that they've experienced for 15 to 20 years. And then we expect everybody just to not be triggered when you see something like that. There is a medical reason for what we are seeing right now, and we've got ignored mental health for decades. And then a trigger is provided and a reaction occurs. And then everybody's talking negatively about these reactions instead of what should have been done for 15 to 20 years. So yes, we need colonoscopies. Yes, we need prostate screenings. Yes, everybody needs to get their blood sugar checked. Yes, we need to have all of that stuff done. And there's a long list of what they need to be a screening. But the most important thing we need to be able to do for Black men in general and men of color in general is address the mental health gap that we don't want to address. That's to me probably one of my largest passions when it comes to getting healthcare to people of color is we've got to start with mental health care. We really do.
Yeah, excellent point. Yeah, we were recently awarded a $1 million grant from the University of Wisconsin School of Medicine Public Health, the Wisconsin Partnership Program. And that funding is specific for the Black Males Mental Health and Wellbeing Project. And so I'm very pleased and happy to be able to lead that. And so we're looking at focusing on more of the southeastern Wisconsin, focus on Dane County, Milwaukee, Racine, and Rock County. But we cannot forget about our brothers down there in Kenosha either, because they're still reeling from that trauma. But what we also realized is that we did an event with the Wisconsin Legislative Black Caucus, and it was a Black History Month event. But we ended up reaching and finding all of our brothers. We got brothers up in Marshfield, up in Green Bay, up in Appleton. And so oftentimes we just can't forget about them because we know some of the stressors that they're dealing with being in some of those areas. So I agree with you. The mental health is a big one. The other area that I wanted to make sure that I mentioned, we did a men's health event earlier in the year, and we invited Dr. Kevin Whitlow. He is the former team physician for the Detroit Lions. And he came in and just talked about men, just helping them. If you're making New Year's resolutions, make sure you get a full plan together. But he said something that all of the men walked away with, feeling inspired. But he said, as a physician, I come in with my agenda. You're going to come in with an agenda, then we're going to go with my agenda. And so we're really pushing, encouraging our men to establish an agenda. When you know that you have that appointment, we want you to start documenting. If you're feeling a funny body ache, document that down. And so that when you're ready to go into your appointment, you have something to discuss with your physician. So we're seeing that we need to get more aggressive with encouraging and maybe even educating our men on how to set agendas so that when they do go into that doctor's appointment, they can get their needs met, as opposed to kind of looking at the doctor with that deer in the headlight look and letting the doctor dictate what's going to happen. So very important. I want to talk real quick. Can you talk about COVID vaccination reluctance among men of color and what barriers exist?
We see a lot of it. I think it's once again, it's a failure of healthcare over decades, and then suddenly expecting it to work. Like, well, what do you mean you don't want to get the shot? You've got to go back, and you've got to talk and be very blunt. I speak at churches after church services, both Spanish and African American churches, and talk about the vaccine because it's a captive audience. And so many of the pastors and priests have been just so welcoming to me to be able to do that. It's just been a great opportunity. And I have addressed Tuskegee just straight out. What was it about and how is this different? And I've kind of gone back to the other point about how to motivate people to get the vaccine. Well, number one, be honest about it. I know the J&J issue is going to come up and people are going to say, well, see, you designed that shot for the Black and brown communities, one and done. That's what you're using with homeless. That's what you're using with that. And that's the one that has a problem. So I'm going to get ready to discuss that because it's not the intent. The pause was done there to really let healthcare catch up on some of the science and understand it. But understanding the vaccine and understanding all of those issues as quickly as possible and being able to communicate that. But once again, what the county executive and I were talking about a little bit, making sure that they know if they don't get vaccinated, that this suddenly becomes a Black and brown disease. That, this is our chance to not make it, not kill our own people. And to be very blunt about that conversation, we need to do that. And we have to be very honest about answering questions too.
Mm-hmm. Excellent.
Yeah. And, I remember when the vaccine first came on and, I think 2 months before we even opened it up, we were already talking about hesitancy in the Black community. And I would say that, I thought it was premature to talk about hesitancy when we didn't give people access. And it's important that before we start talking about hesitancy, that we understand where can people actually get the vaccination shot? Is it easily and readily available to them? Can they only use the technology? Can they call? Can they do walk-ins? But it's not to say that we don't have a population out there that are hesitant. And again, I think this just goes back to one, when I got my first vaccination shot, we made sure to publicize it. We wanted people to know that it was safe. Myself, the county board chairwoman, who's a Black woman and is a millennial, she got her shot, as well as the common council president of the city of Milwaukee. They came with me. And so we want to continue to be examples. But, this is really going to be about how much education we can get out there, how many trusted voices and faces we can get on board with the campaign to get the vaccination. But we also need to understand that these are difficult conversations. These are healthcare conversations that people have a choice to make. And many of us knew, what this was going to look like, especially if you want to compare this to, for example, the flu shot, when you think about Black and brown communities and how many people may or may not receive that shot. So we need to make sure that we continue to educate as many people as possible. It's going to be a battle. But nothing has come easy with this pandemic, and I think all of us has to adapt as needed. But we're going to have to continue to beat the drum on the vaccinations as well as on healthcare in general, because I think this is also a moment in time where we, as Black men, men of color, men in general, and people in general, have the ability to start establishing some care with a healthcare provider, so we can eliminate many of the disparities that we've been talking about on this call.
Yes, excellent point. We're looking at time is 2:08, so the time is dwindling. But I want to get this last question in. It was a question that looked like it was submitted in the chat. And let's, Isaiah, if you want to give me an idea of this, are there generational differences, and do older men need different messaging than younger ones when we talk about, let's say, COVID?
I would say that, yes, there are generational differences, of course, but I guess the real way to key in on that was you're going to have your old warriors, you're going to have your young warriors, and it's a common thing, and that's the press where I would go to, and so that's the messaging is time to step up. So.
Absolutely. Yeah, we're starting to see more as I'm out and I'm, seeing men and women walking in the community. We're starting to see definitely more and more older African Americans out walking in the community. I think we can be better at supporting our Asian community so that, what's going on with them and them being unfairly targeted. We just, if that community is listening, please join. We have a very active Black Men Run walk group that we do every Saturday morning. We want these groups that may be living in a little bit of fear. Come and join us. We'll wrap our arms around you.
This was great. I want to say thank you to the other panelists as well. And thank you to all of our guests and attendees. This has been a great conversation. Yeah. So when we talk about just healthcare in general, I think it's extremely important that we all try to establish some healthcare with a provider as soon as we can, especially during this time when we think about the long-term effects of COVID. But if you have not received your shot, I highly recommend you to visit healthymke.com. You can find information, the facts, and you can learn about the efficacy of all of the different vaccinations as well. And if you live in Milwaukee County, you can utilize that website as well to sign up to get your vaccination as well. But whether you are vaccinated or not, we all have a role to play when it comes down to crushing COVID. And so we need to make sure that we continue to follow the 3 W's, which is wash your hands, wear a mask, and watch your distance whenever you can, because that's the only way that we're going to get back to a sense of normalcy in the future. And again, thank you so much for this opportunity, and thank you for joining us.
Excellent. Dr. Ashok.
Thank you once again, everybody, for tuning in, and really want to stress the importance of vaccination. We don't want this to become any worse than it already is. Way too many souls have been lost, and we don't want to lose any more. So please get vaccinated, but don't make that the end of your healthcare journey now. Use this conversation, establish, with a provider, and come in with your agenda, come in with your list of what you want to talk about. Don't forget about mental health. It's not a shameful thing to admit that we all need it. I go to counseling. I will say that publicly in front of all of you. It is necessary for us to heal our minds, to heal our bodies. And lastly, my last plug is, if you've got a young one, if you're a father, talk about going into healthcare. We need more people that look like us in our profession for us to get better as a profession. So, motivate those around you to go into healthcare. If you're looking for a new career or a new field, think about us. You don't have to be a doctor. There are so many, and you could be a doctor, and I want you to be, but there's so many different aspects to healthcare that we need better representation of all colors in, especially here in the state of Wisconsin, and especially in Green Bay and Sheboygan and the towns that have Black and brown people in them that just don't have that level of representation. So think about it. Motivate those around you to be healthier. take care of yourself.
Yes, yes. Mr. Funmaker, got some words you want to close us out with?
Yeah, just hope everybody stays in the fight, doing what you do to take care of yourself and your family and everything like that. Just wanted to say thank you guys. Wonderful meeting you, and thank you everybody for tuning in.
Yeah, absolutely. Thank you. Thank you so much. And guys, thank you all for joining us. I do want to, kind of reiterate the mental health piece. I think we all at some point can benefit, particularly men of color, can benefit from, I know we don't lay down on the couch and, listen to the counsel anymore. You can do it by, they have telemental health now. They have other means that we can meet, but definitely make sure you're taking care of your mental health. There's no way that we can continue to watch what's playing out in our community. And I'm a former cop, and I left the police department because of a lot of what we're seeing today. I just could not be a part of that. I was inside that house, and it wasn't a good fit for me. But what I can tell you is there's no way that we can continue to watch this play out and not be impacted by it. And so let's make sure that we are definitely taking care of our mental health. And let's also be better stewards at extending a hand to someone in the community that may be struggling. We are now working on developing mental health ambassadors. We're putting together a mental health CPR. So we're going to be bringing that to the community, but we need more ambassadors in the community. And I'll leave you with this real quick story. If someone is in the community, or let's say, for instance, if I'm in St. Louis and I decide, okay, tomorrow I'm just going to drive to Madison and shoot the first 15 people that I see, nobody can stop me. Law enforcement will intervene, but no one can stop me. But you know who can stop me? Having those mental health ambassadors in our community that are saying, wait a minute, Aaron is not looking quite right. We need to wrap our arms around him. And that is how we begin to make this difference. I know that was a tough example to use, but we also know that it is what's playing out in our communities. And so if we can develop and train mental health ambassadors better, get our Black men trained and CPR and the AED. What we do know is that if an African-American man passes out for cardiac arrest in most places in their community, they will be the last one to actually receive CPR. And so we have to get better stewards of that and understand what we're dealing with. But with that said, thanks again, everyone, for joining us. This was fun. Any other words you got to say? I think we got a few more seconds left, but any other words? If not, we're going to turn it over back to Mr. Sanders.
This is 365 Media.